Hi guys, what's our today's plan about previous question paper discussion?
Today we are going to discuss 2016 August previous question paper.
Okay guys, let's start from first essay question.
Okay, the first essay question is explain in detail the principles, techniques of proprioceptive neuromuscular facilitation, PNF. The techniques of proprioceptive neuromuscular facilitation rely mainly on stimulation of the proprioceptors for increasing the demand made on the neuromuscular mechanism to obtain and facilitate its response. Treatment by these techniques is very comprehensive and involves the application of the principles of proprioceptive neuromuscular facilitation to every aspect and in every phase of the patient's rehabilitation.
Basic principles of PNF: manual pressure, placement of hands in direction of the desired movement, verbal stimulation, use the correct wording to achieve the desired movement. Push-pull, visual stimulation, show the patient how to do the desired movement. Give starting and end points to the patient, joint integrity, traction, stretch, elongation of all the muscle of the pattern against gravity, B, approximation, pressure through the long axis of the structure, distal to proximal, with gravity, quick stretch, trigger the stretch reflex of the muscle spindles. Not necessary in orthopedic problems. Not used with pain. Maximum resistance, amount of resistance, which allows the patient to move rhythmically and pain-free through the entire range of motion. Graded to each patient and her pain, isotonic B, isometric, build up tension to maximum and maintain until strength starts to decline, then gradually release. Patterns, use linear, functional patterns. Patterns are diagonal and spiral, timing, distal to proximal or proximal to distal. Use the stronger components to irradiate to the weaker. P to D means strong P to irradiate D. D to P means strong elbow to irradiate weak shoulder. Techniques of PNF: rhythmic stabilization, isometric, take to point of pain, B, hold in the pattern isometrically until patient begins to tire, C, change resistance to antagonist muscle group and hold without allowing the body part to move, D, work the tight muscle first, E, be sure to work the rotation, hold, relax, works the agonist, move body part to point of tightness, B, contract with the tight muscles isometrically, C, move to new range of motion either actively or passively, contract, relax, antagonist, move body part to point of tightness, B, contract isotonically with antagonist muscles, rotation movement only, C, move to new range and repeat, repetitive initiation, stretch and guide through the pattern until the patient learns the pattern, B, after learning the pattern gradually increase the resistance. Traction and approximation, they may be effective in stimulating proprioceptive impulses arising from joint structures. Commands to the patient, the physiotherapist's voice is used as a verbal stimulus to demand the patient's maximum voluntary effort.
Strengthening technique: slow reversal, patterns, work in pattern through range of motion. B, apply maximal resistance to allow patient to move through entire range normal speed. C, start reversal before patient has finished previous pattern. Repeated contractions. A, begin working in pattern until you find weak point in range of motion. B, at that point build up resistance to isometric and hold. C, then pull back and move forward again. D, repeat several times. Eccentric contraction, used to develop deceleration abilities and proprioception, agonist reversals. Reinforcement, innumerable combinations of movements are required and utilized in everyday life, and when great effort is required, movement of the part of the body is associated and reinforced by those of other parts. This can be observed in heavy work and sporting activities when strength or concentration are required.
Guys, today we have completed one essay question. See you tomorrow. Bye.